Hi, my name is Øyvind Pedersen. I'm from Norway, 49 years old. My story is that I've been active in sports all my life, competitively, in track and field, running, and also triathlons. Hurt my knees, my first knee approximately 20 years ago while running. Was told it was a torn meniscus, and that I had to had a knee scope done, and they did that and shaved some of the meniscus off and said it would be perfect, wouldn't bother give me any more problems, which was not correct. I had lots of problems, and it got worse and worse. I had several knee scopes, and after a while my other knee also started to hurt, and it was the same story with that one, torn meniscus. I had the scopes on that too, and both knees gradually got worse and worse over the years. I was basically told the same thing, that my knees were worn out. There was nothing that could be done except a total knee replacement. I didn't quite buy into what they were saying, that there was absolutely nothing that could be done. So, like a lot of other people, I started looking at online to searching for solutions or any kind of hope for procedures or anything that could help me. That's where I found the Stone Clinic. I went to some doctors, showed them what I found, and asked them what they thought, and every single one of them said, no, it's not a good idea, it won't work for your knees. The bio-knee they haven't really heard of, or they said that, oh, this has been tried, it never works, this is old stuff, you know, it doesn't matter technology, we know it all, it won't work. Full knee replacement, that's your option. In my mind, it looked like a good solution, and I wanted to come here, meet everybody, and talk to them and see if my feeling, the good feeling I had still was the same when I got here. The feeling I had before really just got even better when I saw the people, how they worked, how they talked to each other, and the whole atmosphere in the office. Doors open, everything looked really good. Met Dr. Stone. He looked at my x-rays, my MRIs, and said exactly what I wanted to hear, basically, that I can help you. So what he suggested for me was not the bio-knee, but it was the partial knee replacement on both knees. I asked him what will be my limitations for these procedures, and he looked at me and said, what limitations? And that really made me believe that it was the right thing for me. He said, you can basically do whatever you want. I said, well, I know you probably can't give me any guarantee, you know, if you will succeed helping me. And he said, well, I can. I'll give you 98%. And I just loved his attitude, the whole everything. So right there, I decided I'll just go home, sort out my things, and come back and do my knees. So we decided that I would come back, do my left knee first, then wait 3 weeks, which is really close. In Europe, they would almost want half a year in between each. And so we did one, waited 3 weeks, did my other one. Now it's 5 weeks since I did my first one, and it's 2 weeks since I did my second one, and everything looks really good. I'm really happy. It's very important to me that I can live my life the way I want to. All the doctors I've been seeing back home and all the specialists, they said, well, you know, you're getting older. Just accept that, you know, it's other things in life that are nice too. But I want my life. It's my life. I want to be able to make my decision, what's important to me and what I want to do or don't want to do. I recommend anybody that has have problems, has been told that nothing can be done, talk to Dr. Stone, set up an appointment, come and check it out for yourself, and I highly recommend it. I'm very happy.